Hello, class. Our lesson for today is on chapter 2 of the Understanding the Self, Unpacking the Self. Lesson 1, the physical and sexual self. So, first, let us know what is our lesson objectives. So, first, discuss the developmental aspects of the reproductive system, describe the erogenous zone, explain the human sexual behavior, characterize the diversity of sexual behavior, describe sexually transmitted diseases, and differentiate natural and artificial methods of contraception. So, this will be our learning objectives in this lesson. So, ito yung matututunan natin sa lesson na ito. But first, let us define the physical self. Ano nga ba yung physical self? Okay, physical self daw refers to the body that includes parts such as head, shoulders, knees, and toes. While also it is made up of other organs such as heart, lungs, brains, stomach, and muscle. So our physical self class generally refers to the natural material aspects of the entire person in contrast to the things that readily visible such as our mental, emotional, spiritual, and other human dimensions. So in other words, it denotes what is perceivable, tangible, and concrete. Okay, so ano yung makikita natin? That is our physical self. Let us also define what is sexual self. So, because our topic is the physical and sexual self, i-define na natin silang dalawa. So, what is the sexual self naman? So, sexual self speaks about your sexual health, your sexual orientation, gender identity and expression, and values around sexuality. So, this is a part of yourself where you learn and understand your sexual development and how people's sexual activity, beliefs, misconceptions can influence your own sexual behaviors and responses. So, it is about your own understanding about sexuality and other sexual development and how other people's sexual activity and beliefs and other things influence your sexual behaviors and responses. Okay, class, I would like to emphasize that we are taking this topic in an objective manner, meaning without malice. So please be open-minded sa mga topics natin yan. And I know we are all a sexual being, so please be understanding, and syempre yung purpose ng lesson natin na ito is for educational purpose. Okay, we are civilized and professional. Next, why do we look the way we do? Bakit ganito daw yung itsura natin? Sige nga. Okay. Humans daw are said to be sexually dysmorphic. Okay, ano ba yung sexually dysmorphic? It is the difference between the size and the appearance of males and females. So accordingly, males are taller, mas mataas daw yung males. They have a heavier skeleton, large proportion of body weight and muscle, greater strength, larger heart, lungs, which allows them to have a larger aerobic capacity. Also, they have a greater intake of oxygen during physical tiring activities. So, di ba, syempre yung mga lalaki daw mas malaki sila, more athletic sila. While in contrary, yung mga girls daw or mga females daw yung malaki lang sa atin is the body weight in fat and a wider pelvises. Okay? So in adolescents, secretion of various hormones significantly affect the physical changes that occur during puberty. So it is said that hormones impact almost all aspects of adolescents' development. It is the time of growth when weight and height rapidly increase. So when you look at your reflection in the mirror, you see these changes in your physical self. So makikita mo yung self nyo. Kapag makita nyo yung self mo, may mga changes kayo during elementary days, high school days, and up to the present. Diba, iba-iba yung mga pansin yung mga developmental changes. How do we become males and females anatomically speaking? So, paano daw tayo naging lalaki, paano daw tayo naging babae? So, first is there you called a indifferent stage. So, the embryo's gender is not distinguishable for the first weeks of development. This is known as the indifferent period of development. So, during the 6 weeks of pregnancy, ng mga babae, hindi pa natin malalaman yung gender ng isang baby sa tummy ng nanay niya or sa tummy ng mothers nyo. So, this is what you call the indifferent stage because hindi distinguishable, hindi pa natin malalaman kung anong gender ba ng baby sa sinapupunan ng nanay natin. So, hindi nila alam if boy tayo or girl. So, dito pa lang nabubuo yung mga organs natin. And dito sa indifferent stage na to, if there is any intervention or may pagkakamali lang with the normal pattern of sex hormone production, there will be a strange abnormalities. So, ano ba yung mga strange abnormalities na to? For example, dito sa book nyo is the pseudo-hermaphrodites. Ano ba ito? It refers to someone whose external genitalia are not consistent with his or her gonadal sex. Also, another example is the hermaphrodites. So, the condition of having both male and female reproductive organs. So, dalawa yung meron siyang ari ng lalaki at meron din siya nung babae. Next, the female offspring is a result of combination of XX chromosome at the same time of fertilization while the XY combination result in a male offspring. So, pag kinombine daw yung XX chromosome, yun daw is for the female while yung XY chromosome yung combination is for the male. So, the dominant male hormone is the testosterone. Siguro class alam nyo na to nung high school and elementary natin or high school siguro. Na-discuss na siguro ito sa biology. I-review ko lang. Parang i-ano lang natin, run through. So, the dominant male hormone is the testosterone while the female hormones are estrogen and progesterone. Okay, during the puberty, the sex gland ovaries for girls and testes for boys become active, leading to the increased production of sex hormones. This will initiate the unfolding of the menarche or the first menstruation for girls and nocturnal emission or wet dreams for boys. So, a significant part of the maturation process is the awareness of differences pertaining to human sexuality. So, discuss natin yung human sexuality. So, what is human sexuality? Human sexuality is a complex phenomenon which involves the interaction of persons' biological sex, core, gender identity, and gender role behavior. Hence, it can be a combination of biological, physiological, and psychological factors. So, our sexuality daw class is expressed in various ways. our manner of dressing, for example, the body movements are some of the ways that communicate our sexual self. So the way daw we dress and the way our body moves is uh, some of the examples to communicate our sexual self. So our human body has certain parts which are considered as erogenous zone. So dahil dito meron tayo sa body natin na kino-consider na erogenous zone. So ano ba yung erogenous zone? So erogenous zone refers to a parts of the body that are primarily perceptive and increase sexual arousal when touched in a sexual manner. So, for example, ano yung mga parts na yon or mga body parts? So, these are mouth, breast, genitals, and anus. So, class, this may vary from one person to another person. Okay? As sexual beings, it is likely for human beings to engage in sexual activities. Okay, class, please be open-minded with our discussion for today's video. Millennial. So, human sexual behavior is what? It is any activity solitary between two person or in a group that includes sexual arousal. Okay, ano daw? Ito yung sexual, pwede dito yung sexual intercourse. Next, there are two major factors that determine human sexual behavior. HSB class haba kasi ng human sexual behavior. So, first is inherited sexual response pattern or which can be inherited in the design of human beings. And another one factor is the extent of expression of the sexual behavior or activity. Ano ba ito? So the extent of expression of the sexual behavior or activity can be influenced by one's belief, values, orientation, societal standards, and our norm. So class, yung inherited sexual response, ito yung normal sexual response ng isang female and males, while the extent of expression of sexual behavior or activity is somewhat, ano ba, ang hirap ng ito yung na-influence na ng, for example, yung BDSM, yung parang sa mga movies na yan na may mga role play sila, may mga costume, mga ganon. And depende sa culture, so values and beliefs ng isang tao. Yung extent of expression na ine-express mo yung self mo eto yung pag-express mo ng self mo in a sexual manner. Next, types of human behavior. So, there are two types of human sexual behavior. These are solitary behavior or ikaw lang isa, one individual. And then, socio-sexual behavior or more than one person. So, a sexual being, it is likely for human beings to engage in sexual activities. So, tandaan natin to class ha. Please be open-minded in this discussion. Pinapaulit-ulit ko sa inyo. Solitary yung pwede dito yung masturbation ng isang tao. While the socio-sexual behavior is, ano ba yung magandang example dito? Group sex or may threesome yun. Next is the physiology of human sexual response. So, in relation to sexual behavior, let us now explore the human sexual response cycle. Again, class, please be reminded that the intention of this is for education. So, I am not suggesting you that you rush into trying this to validate what the literature says, okay? Just, this is for education purpose only, class. Dahil ano sabi ni Kuya Kim, lamang ang may alam. Okay, what is sexual response? Sexual response refers to the sequence of physical and emotional changes that occur as a person becomes sexually aroused and participates in sexually stimulating activities including intercourse and masturbation. Ito yung response ng isang tao na ginagawa or response ng isang tao kapag may sexual activity siya. So, knowing how your body responds during each phase of the cycle can enhance your relationship and help you pinpoint the cause of sexual problem. So, it is important to know if saan ba yung may mali or may tama sa mga ginagawa nyo. This will also help you improve your relationship in the future class, relationship with your partner, husband, wife, or ano pa? Ano pa yung tawag nyo? Okay. So, the first cycle is the excitement phase. Okay? So, there are four sexual response cycle. There are four phases. So, first is this excitement phase. Next is the plateau phase, the orgasm, and the resolution. So, we will discuss first the excitement phase. So, excitement phase, it is caused by increased impulse and blood pressure, a sudden rise in blood supply to the surface of the body, resulting in increased skin temperature, flushing, and swelling of all distensible body parts, particularly noticeable in the male reproductive structure and female breasts. More rapid breathing, the secretion of genital fluids, vaginal expansion, and general increase in muscle tension. So these symptoms of arousal eventually increase to a near maximal physiological level that leads to the next stage. So dito may ano tayo dito may ah no chart. Chart ba to? Picture ng mga stages. So excitement stage yung una. Ito yung nagwa-warm up na yung body mo sa sexual activity. So dito na daw magsa-start na mag-rise yung blood pressure and yung pulse natin. And also, there will be umiinit na yung katawan and also yung sa males unti-unti na nag-erect yung kanilang uh, male parts and as well as sa female yung breast nila parang uh, may noticeable na change and also yung breathing parang bumibilis and also the secretion of body fluids or genital fluids and yung vaginal expansion also dito din nagaganap and muscle tension. And then the next phase is the plateau phase. So it is generally a brief duration. If stimulation is continued, orgasm usually occurs. So dito yung brief duration lang daw ito. So ito parang malapit na sa orgasm na phase. So ano ba yung orgasm? So orgasm or sexual climax. It is marked by a feeling of a burp, intense pleasure, a rapid increase in pulse rate and blood pressure, and a spasm of the pelvic muscle causing contraction of the female reproductive organ and the ejaculation by the male. So, di ba, yun na, excitement phase na, doon na nagsa-start ng lahat. Then, plateau, parang dito na yung parang malapit na part papuntang orgasm or sexual climax. And then, yung sexual climax, eto na yung your orgasm sa female reproductive organ and then yung ejaculation or pag linabasan na yung male. Yan na yung orgasm sa kanila. Tama ba, boys? Okay. Then next, and also dito sa sexual climax na to, it also characterized by involuntary vocalization. And sexual climax may last for a few seconds, normally not over 10. according sa studies, and after which the individual enters the resolution phase. So next stage na tayo, pang last stage or the fourth stage phase. Resolution phase, it is the last stage that refers to return to a normal or subnormal physiologic state. So ito na yung balik kayo sa bago yung excitement phase. Yung parang nagpahinga ulit, parang ganun. So males and females are similar in their response sequence. Okay? Males and females daw ay pareho lang yung cycle. Whereas males return to normal even if stimulation continues. But continued stimulation can produce additional orgasm in females. So kapag daw yung females is may continuous na stimulation sa mga genitals, may additional daw na orgasm na magaganap. So, females are physically capable of repeated orgasms without intervening rest period required by males. So, yung males daw is required na magpahinga muna bago ma-reach yung orgasm ulit. Pero yung females, capable daw sila sa repeated orgasm. Well, yung males hindi. Both men and women experience these phases, although the timing usually is different. So, hindi lahat sabay-sabay na makarating sa sexual climax or the third phase. Okay, kasi minsan nauna yung lalaki or minsan nauna yung babae. It varies from person to person. Okay, next. Okay. So yun na, na-discuss na natin yung sexual response. So, dito, i-discuss din natin yung mga sexual problems. Sa males, ihiwalay natin class yung males tsaka females. Mag-umpisa tayo sa males. So, males, dito sa males, merong male hypoactive sexual desire disorder. So, ito ay little or no desire to have sex. So, parang yung male daw walang ganang makipagtalik. Okay, so, ano yan class? Sexual problem na yan. Lalo na kapag may asawa na kayo, di ba, normal lang yan sa mag-asawa na makipagtalik. So, this will hinder your relationship to your wife if walang gana yung lalaking makipag-sex. So, magkakaproblema yung relationship ng dalawa. And also, this is also considered as a dysfunction because nakakaabala na sa normal na life ninyong mag-asawa. Next, erectile disorder, difficulty attaining or maintaining erection. So, dito naman is yung lalaki, hindi niya ma-maintain na patayuin yung male organ niya. So, dito magkakaproblema talaga kayo ng asawa niyo or ng partner niyo. Next is the delayed ejaculation and premature ejaculation. So, delayed yung labasan yung lalaki. And then, meron ding masyadong early yung dinalabasan yung lalaki. So, yung delayed masyadong matagal, yan yung meaning yan. And then yung early, ang mabilis lang. Yun yung meaning yan, class. Next is sa females naman tayo. So, ano ba yung mga sexual problems ng females? Sa females. So, first on the list is the female sexual interest / arousal disorder, little or no desire to have sex. So, walang ganang makipag-sex yung babae. Ito yung tawag sa kanila, female sexual interest / arousal disorder. Ang haba, no? Kaya nyo yan kasi memorize sa exam. Joke lang. So, next is the female orgasmic disorder. So, unable to reach orgasm. And then, genitopelvic pain penetration disorder. So, pain, anxiety, and tension associated with sexual activity, vaginismus, for example, muscle spasm in the vagina that interfere with penetration. Nagko-contract yung pelvic ng isang babae kapag nag-intercourse na. So, di ba, parang masakit din yun sa lalaki kapag biglang lumiit yung ng babae. Yan. So, that will also cause a problem with your partner. Class, move on na tayo sa mga sexual problems. Dito naman tayo sa sexually transmitted disease. What is sexually transmitted disease? So these are infections transmitted from an uninfected person to an uninfected person through sexual contact. Ano ba yung mga ibang klaseng mga sexually transmitted disease? So, popular talaga yung HIV na to, class. Ano ba yung HIV? Or the human immunodeficiency virus. So, it is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. It is spread by contact with a certain bodily fluids of a person with HIV, most commonly during unprotected sex or sex without a condom or HIV medicine to prevent or treat HIV or through sharing injection drug equipment. Ano ba yung AIDS? Acquired Immunodeficiency Syndrome. So AIDS is the late stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. So class, AIDS is under the sexually transmitted disease. The cause of AIDS is the HIV. Class HIV is a virus, kaya nga VHIV virus. Okay? The cause of AIDS is HIV. If left untreated, HIV can lead to the disease AIDS. Hindi ko na palalalimin pa yung discussion ko sa HIV and AIDS. Dahil madami pa tayong i-discuss na iba't ibang klaseng sexually transmitted disease. Next is chlamydia. Gusto ko sanang maglagay ng pictures kaso habang nagse-search ako ng mga pictures, parang hindi ko kayang hindi ko kayang tingnan. So, class, pwede i-search niyo na lang kung ano yung itsura ng mga sexually transmitted na disease na to na kapag na ano na sa iba't ibang tao. Kindly search niyo na lang kung ano yung itsura ng mga diseases na ito sa pag nasa tao na sila. Okay, thank you. Next is chlamydia. It is a common STD or sexually transmitted disease that can cause infection among both men and women. It can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant. Chlamydia can also cause a potentially fatal ectopic pregnancy or pregnancy that occurs outside the womb. So, you can get chlamydia by having vaginal and anal or oral sex with someone who has chlamydia. Next is the syphilis. What is syphilis? It is a sexually transmitted infection or disease that can cause serious health problems without treatment. Infection develops in stages. So, meron daw stages. Primary, secondary, latent, and tertiary. So, each stage can have different signs and symptoms. Next is chancroid. So, it is a bacterial condition that causes open sore on or around the genitals. So, class, please search nyo lang sa Google kung ano yung itsura nito. It is a type of sexually transmitted disease or infection, which means it's transmitted through sexual contact. Search nyo lang yung pictures nito, guys. Next is a human papilloma virus. So it is the name of the very common group of viruses. They do not cause any problems in most people, but some types can cause genital warts or cancer. So, eto yung genital warts na tinatawag nila. So, class, please search nyo lang kung ano yung itsura nito, class. So, next is herpes simplex virus. So, it is a virus that causes infection. It is very contagious. So there are two types of this virus. One type is HSV1, usually causes sore around the lips or inside the mouth that are sometimes called fever blisters or cold sores. So ito yung mga nakita ko yung picture nito, parang may mga nana-nana na yung sa mouth nila. So, please search na lang to class. So, the other type is HSV2, usually causes sore on the genitals or the private parts. So, either type can infect mouth, genital area, or another part of the body. So, class, please search on this. And then, next and last is Trichomonas vaginalis or trich. So it is a very common STD caused by infection with Trichomonas vaginalis or a protozoan parasite. So it is trich is a parasite. So in women, the infection is most commonly found in the lower genital tract or the vulva, vagina, cervix, or the urethra. While in men, the infection is commonly found inside the penis or the urethra. So class, please search nyo talaga to class. Okay, so next is the natural and artificial methods of contraceptions. Ano ba yung meaning ng contraception class? So, yung contraception is the means of preventing a woman to get pregnant. Okay? Or an artificial or natural methods to hinder or prevent a woman from getting pregnant and also para makaiwas din sa mga sexually transmitted diseases. So, first online is the abstinence. So, what is abstinence? Class, this involves refraining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. So, this is the most effective daw way on preventing pregnancy. So, abstinence. So, wala munang sexual intercourse. Next is the calendar method. In this method, you use past menstrual cycle to estimate the time of your ovulation. When used on its own, this is the least reliable method of birth control. It should be avoided if your menstrual cycles are shorter than 26 days or longer than 32 days. Merong app nito na tinatrack mo yung menstruation mo. And meron ding sinasabi doon na if ganitong week, safe kang hindi maging pregnant and itong week, pwede kang maging, higher chance kang maging pregnant. So, that is the calendar method. So, ito yung, hindi ito advisable sa mga women na may shorter than 26 days yung or longer than 32 days yung menstruation nila. And next is the basal body temperature. So the basal body temperature method involves observing a woman's temperature every morning. Because a woman's temperature drops about 1 Fahrenheit 12 to 24 hours before her ovary releases an egg. So, ito daw yung minomonitor nyo yung temperature ng babae every morning. So, this indicates a period of high fertility. So, you should abstain from intercourse during this time if you're avoiding pregnancy. This period lasts from temperature drop until 48 to 72 hours after it returns to normal. Next is the cervical mucus method. So, in this method, you track the color, thickness, and texture of your cervical mucus to monitor your fertility. So, your cervical mucus becomes thinner, slippery, and stretchy when you ovulate. So, tracking your cervical mucus will require some practice. So, as a girl, females, ito din yung isang method na itatrack mo yung mucus mo to know if you are fertile or not. Next is the symptothermal method. So, symptothermal method is a method in which you use all three of the methods above. So, it is the calendar method, basal body temperature, the cervical mucus method. So, that is the three methods. So the next natural method is the symptothermal method. So what is symptothermal? So symptothermal method is the use of all those three methods mentioned above. So those three are the calendar method, the basal body temperature, and the cervical mucus method. You combine those three methods. Okay, next is an ovulation detection. So, ovulation detection method uses an over-the-counter kit that requires the urine sample of a woman. So, the kit can predict ovulation through the search of luteinizing hormone that happens 12 to 24 hours before ovulation. So, you can buy this at a drugstore or over-the-counter pharmacies. And then next is coitus interruptus. So this is the oldest method that could prevent prevention. So it is withdrawing before ejaculation or when withdraw ng lalaki yung ano niya, yung genital niya before siya malabasan. Okay, so let us now proceed to the artificial methods of contraceptive. So the first one is oral contraceptive. So ito yung picture, ilang example ng oral contraceptive. So oral contraceptive, also known as pill, contains synthetic estrogen and progesterone. So to use this pill, it is recommended that the woman takes the first pill on the first Sunday after the beginning of a menstrual flow. Okay, or the woman may choose to start the pill as soon as it is prescribed by the doctor. It is advised that the first 7 days of taking the pill would still not have an effect. So, the couple or the partner must use another contraceptive methods on the initial 7 days. Okay? So, if the woman has skipped 1 day of taking the pill or the oral contraceptive, she must take it the moment she remembers it. So, i-take niya na kaagad if na kalimutan niyang i-take. Then, after that, i-follow lang yung regular use ng contraceptive na ito. So, if the woman has missed taking the pill for more than 1 day, she or her partner must consider an alternative contraception to avoid ovulation. So, side effects of these oral contraceptives are nausea, pagsusuka, weight gain, tumataba, headache, breast tenderness, breakthrough, bleeding, vaginal infections, mild hypertension, and depression. Okay, next artificial method is the transdermal patch. Okay, I have an example here, a picture. So transdermal patch has a combination of both estrogen and progesterone in the form of a patch. So as you can see, the square one, yan yung patch. For 3 weeks, the woman should apply one patch every week on the following areas. So saan ba ilalagay ito? Upper outer arm, upper torso, abdomen, or buttocks. So at the 4th week naman, no patch is applied because there would be a menstrual flow or may menstruation. So the area where the patch is applied should be clean, dry, free from any applications. So also, dapat walang redness or irritations. So patches can be worn while taking a bath or swimming, but when the woman notices that the patch is loose, kapag parang matatanggal na siya, kailangan palitan na agad. So if the patch has been loose for less than 24 hours, the woman need not to use an alternative form of contraceptive, but if she is not sure of how long the patch has been loose, she should replace it and start with a new week cycle and also use an additional contraceptives. Okay, next artificial method is the vaginal ring. So the vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. So this silicone ring, okay, this one, yung bilog na ito sa box, this is inserted in the vagina and remains there for 3 weeks. Then removed on the fourth week as yun na nga, may menstrual cycle or may menstruation. So the woman becomes fertile as soon as the ring is removed. So the vaginal ring has the same effectivity rate as the oral contraception. Next is the subdermal implants. So the subdermal implants are two rod-like implants embedded under the skin of the woman during her menses or on the seventh day of her menstruation to make sure that she is not pregnant. So, saan ilalagay to? So, dito, banda. So, nakikita nyo dyan sa picture kung saan ilalagay yung subdermal implants. So, this implant contains etonogestrel, desogestrel, and progestin. So it is effective for 3 to 5 years. Subdermal implants have a fail rate of 1% only, so mababa. Next is hormonal injection. So a hormonal injection consists of medoxyprogesterone, a progesterone, and given once every 12 weeks. So the injection inhibits ovulation and causes changes in the endometrium and the cervical mucus. After administration, the site should not be massaged so it could absorb slowly. So dapat hayaan lang natin, wag na natin i-massage. So it has an effectiveness of almost 100%. So making it one of the most popular choices for birth control. It is advised that the woman to ingest an adequate amount of calcium in her diet as there is a risk for decrease of bone mineral density and engage in weight-bearing exercise. So, kailangan daw calcium, yung may calcium, yung rich in calcium yung kakainin ng babae, and also mag-exercise. Next one is the intrauterine device. So or for short, the IUD. So the IUD is a small T-shaped object that is inserted into the uterus via the vagina. So ito yung IUD, yung sa picture na yan, class. So it prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. So the IUD is fitted only by the physician and inserted after the woman's menstrual flow to be sure that she is not pregnant. So yung physician lang po ang pwedeng maglagay nito, and it is inserted after ng menstruation. So the device contains progesterone and is effective for 5 to 7 years. So a woman with IUD is advised to check the flow of her menstruation every month and the IUD string, and also to have a pelvic examination yearly. Next artificial method is the chemical barriers. So chemical barriers such as spermicides, vaginal gel, and creams, and glycerin films are also used to cause the death of sperm before they can enter the cervix, and also lower the pH level of the vagina so it will not become conducive for the sperm. So chemical barriers class, ito yung mga iba't ibang klaseng chemical barriers. So madami pala sila, no? Next is the contraceptive diaphragm or cap. It is a circular dome made of thin, soft silicone that's inserted into the vagina before sex. So it covers the cervix so sperm cannot get into the womb or the uterus to fertilize an egg. So if a spermicide is combined with the use of diaphragm, there is a failure rate of 6% ideally and 16% typically. So the diaphragm should be fitted only by a physician also, and should remain in place for 6 hours after coitus. So it can be left in place for not more than 24 hours to avoid inflammation or irritation. So ini-insert din ito sa vagina ng babae. So next is the male condom. So ito yung itsura ng male condoms. So the male condom is a latex or synthetic rubber sheet that is placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. So it can prevent STIs or sexually transmitted disease or infections and can be bought over the counter without any fitting needed. So pwede itong mabili sa mga pharmacy or kahit saang nagbebenta nito. So male condoms have an ideal fail rate of 2% and a typical fail rate of 15% due to the break in the sheets, integrity, or spilling. So may fail rate daw ito na 2% and 15% due to the fact that pwede daw itong mabutas and pwedeng lumagpas yung sperm dun sa parang sheet na ito. So after sexual intercourse, the condom is removed and to be disposed. Next is the female condoms. So these are also a latex rubber sheets that are specially designed for females and pre-lubricated with spermicide. So it has an inner ring that covers the cervix and an outer open ring that is placed against the vaginal opening. So ito yung itsura niya, class. So these are disposable also and requires no prescription. The fail rate of the female condoms is 12% to 22%. Next is the surgical methods, class. So surgical method is one of the most effective birth control method. So there are two kinds of surgical methods. It is either used by male or female and will ensure that conception is inhibited after the surgery for as long as the client lives. So on males, it is called vasectomy. So vasectomy is a form of male birth control that cuts the supply of sperm to your semen or the male's semen. Ito yung vasectomy, class, yung may vas deferens pulled through incision and cut. Okay, so it is done by cutting and sealing the tube that carry sperm. So vasectomy has a low risk of problems and can usually be performed in an outpatient setting under local anesthesia. Okay, next naman sa females. So ito naman sa females kasi yung sa kabilang area. So it is a type of permanent birth control. So during ligation, the fallopian tubes are cut, tied, or blocked to permanently prevent pregnancy. So tubal ligation prevents an egg from traveling from the ovaries to the fallopian tubes and blocks sperm from traveling up the fallopian tubes to the egg. So the procedure doesn't affect your menstrual cycle. So pwede ka pa rin madatnan. So, okay, class, that ends our discussion for this lesson. If you have any question, please feel free to message me in our messenger. Okay? So, you kindly PM me na lang or do a private message if nahiya kayo sa group chat natin. So, thank you for listening and goodbye.